major problems related to the color coordinating assignments for the patient acuity?
Let's talk about staffing and then assignment. So the first thing that has to happen is it's necessary to have the right amount of nurses for the given number of patients. So a lot of hospitals, I mean, all the different, anywhere that we deliver nurse care, that's always a struggle first in looking at what do we need right now. And you see this just in your rotations. What do we need next shift? What do we need, you know? So then there are these short-term things. So when you work with the charge nurses, and work with the nurse managers, they're always trying to really grapple with how do we do this right here and now. When you get higher up in the nursing leadership, then they start asking questions like, well, all right, if we're looking at a year or two in advance. In fact, you know, right now they're looking at how many new graduates are they going to hire? What type of new graduate? So again, let's look at long-term trends based on their understanding about the patient care needs, their acuity, and things like that. So I'm getting off the reservation on your question.
So you think the most important is the staffing before anything else?
You need to have, yeah, that's a critical mass, but that alone can't help us to deliver the best nursing care. Then it gets down to, all right, you have 4 or 5 nurses for, you know, 10, 15 patients. How do you make that assignment? Who's the best nurse for the patient given their needs, the resources we have? Right now, all the literature is based on staffing. In fact, if you look at the quality piece, it's not looking at just staffing at that level, it's looking at staffing, here's the hospital over a year's time. They just kind of lump all that together. Now, we do know from probably over 100 studies that there's a direct relationship between the overall staffing and the outcomes of the patient. So that when we don't have enough nurses, what that means is that the patient care begins to deteriorate. They have more infections, they have more falls, they die more often. That's clear to us, but we don't know exactly at this point how to link the nursing care and the individual nurse to the patients yet. So that's a lot of the things that we're doing across the country are really getting down to that level. The problem is we never had the data. To do that by hand, you see the chart nurses, but that's in a piece of paper that we can't use that to do a statistical analysis. So what we're trying to do is use the electronic medical record, like Lakeland Regional has a new system, and they're actually capturing the assignment. So the next piece is trying to determine how we can use those data to help us understand and answer those key questions. So that's the next frontier from a research standpoint, being able to understand not only the staffing needs, but that individual assignment, you know, that linkage between an individual nurse and an individual patient.